Hello everyone, my name is Kathleen McCauley. For my term project, I chose to research trichotillomania. Hope you all enjoy. What is trichotillomania? Trichotillomania is also known as the hair pulling disease. According to the fundamentals of abnormal psychology, trichotillomania is an obsessive-compulsive related disorder in which an individual repeatedly pulls out his or her hair from his or her scalp, eyebrows, eyelashes, or even other parts of the body. The term trichotillomania is derived from the Greek term that literally means frenzied hair pulling. The DSM states that the diagnostic criteria for trichotillomania is obviously a significant amount of hair loss of the scalp, eyebrows, eyelashes, or other parts of their areas of the body. An individual will usually experience various emotional states, including feelings of anxiety or boredom. The individual visibly or descriptively describes an extreme sense of tension directly prior to the urge to pull hair. Then, after the hair has been successfully pulled, the individual feels a sense of gratification, pleasure, or relief. Most of the behaviors happen unconsciously, but there has been cases of conscious hair pulling. The exact etiology of trichotillomania is unknown. However, there is reason to believe that the cause of trichotillomania is similar to that of obsessive-compulsive disorders. For example, the disorder could be caused by an abundance of life events or as a way for the individual to relieve their emotional distress. Also, the change in hormone levels during puberty could trigger the onset of trichotillomania. The prevalence of trichotillomania is increasing at a rate of 1%, which means there is an estimation of 2.5 million people diagnosed with trichotillomania in the United States alone. This disorder is more prevalent in children than in adults. However, the prevalence in adults ranges from 3.2% to 22.4%. Lastly, trichotillomania is more common in women than in men, with a ratio of 2.5 to 1. The general onset is recognized in late childhood or early adolescence, with an average onset of 13 years old. The disorder could typically begin in adulthood after a stressful life event. However, this is unlikely. In order to accurately treat a client with trichotillomania, most therapists suggest a thorough functional assessment to determine the relationship between behavior, antecedent, and consequence events. The clinicians make this assessment by asking the client several carefully structured questions to reveal information the client may be resisting to share. Every treatment is unique to the individual because each individual responds differently to the following treatments. The first type of treatment is self-monitoring. The clinician will ask the client to self-record his or her hair pulling. The client will record frequency, duration, and the situations in which hair pulling is occurred. This method of treatment provides the client with insight into their disorder. Another behavioral method of treatment is competing reaction training. In this method, the client practices applying his or her urges to pull the hair out onto other ways, such as squeezing a ball of clay, wearing bandages on their fingers, or even just making a fist. This treatment will eventually result in less time hair pulling and more time spent on the alternative behavior. Similarly, the method of habit reversal training aims to change the habit of hair pulling to a physical habit such as knitting. Another form of therapy is group therapy. Group therapy is a great way to gain support, increase awareness, and reduce internal and external triggers. According to the fundamentals of abnormal psychology, an obsessive-compulsive related disorder is defined as a disorder in which Obsessive-like concerns drive people to repeatedly and excessively perform abnormal patterns of behavior. Individuals with trichotillomania suffer from specific rituals as they pull out their hair. Others pull on the hair till it feels just right. Another reason they are considered obsessive compulsive related disorders is because individuals are triggered by anxiety or stress. While doing my research, I came across a case study that I felt explained and showed the disorder very well. A 12-year-old female and her mother reported hair loss over the past 6 months. The girl had seen a doctor before and was prescribed medication for alopecia areata. However, there was no improvement. The mother realized that when her daughter becomes nervous, she has the uncontrollable urge to pull hair out of her scalp. The patient was diagnosed with trichotillomania and prescribed doxepin, fluoxetine, pimozide, and N-acetylcysteine. The patient was also referred to a psychological evaluation. After an additional 6 months, the female patient returned with great improvements. Here are my references. Thank you guys for watching. Hope you guys learned something new.